Good afternoon. Welcome to the ANC Youth League MOKABA region page. Today, comrades, we would want to discuss the issue that is affecting the whole world, the pandemic that indeed it's affecting all of us. It doesn't matter what gender are you. It doesn't matter whether you're black or you're white. It doesn't matter what status you have within the society. We've seen, comrades, that the current pandemic, it's indeed affecting even heads of states. We have seen that whether you're a professional, whether you're not, whether you're an artist, whether you're that's one of the issue that all of us as a humanity across the globe are indeed worried and concerned about what is happening. So we want to appreciate the leadership of the Youth League that have seen it very necessary and critical for us to come and spend this afternoon together so that we can share with each other the experiences, what is happening locally within our province and also within our country and also what is happening globally with regard to coronavirus or COVID-19 disease. So if we are to just remind each other, we would remember that this is one of the viruses that has been there as part of the family of coronavirus. Somewhere around December in a city called Wuhan in China, Hubei province, there was of course a suspicion of this unique virus which to certain patients was complicating into one type of pneumonia which has not been responding to medications that physicians will normally prescribe, and some of the patients were losing their lives until finally the virologists would come up with a virus, the novel 2019 coronavirus diseases, which we call it COVID-19, coming from the word corona, which means crown, as a Latin word, mainly because when you look at under a microscope, you will see a crown-like. If you see most of the visuals that are being sent around, also even in our posters, the pictures that we use of COVID-19, you will see that it's a virus that shows the crown-like when you see it under microscope. So that's where it got its name. So coronavirus, the 2019 new one that has been discovered, it's part of the family of coronaviruses. This family has been there for quite some time. They would cause conditions from just a common cold like a flu to what we called Middle East respiratory syndromes, to what we call now severe acute respiratory syndrome, or SARS-CoV-19, as we are calling what we are having. So when it attacks you as a human being, it would definitely cause, depending on the strength of your immune system. If your immune system is strong, or we differ as individuals, it can cause the common cold flu, which your body can fight it, and hence you would hear us reporting that we had the total cases in the province are 20, but we can report that 10 of them have now been cleared of the virus. They've now tested negative, and most of the time is after 14 days. We usually take them for testing, and they will come back and test negative. And those are the people who usually their immune system is strong, and they are able to, within that 14 days, deal and clear the virus from their body. But there are other people who, once the virus attack them, maybe because one of the comorbidity, people who have got other conditions, for instance, people who are suffering from cancer, some of them even in stage 4 cancer, are not able to fight and clear this virus out of their body. Those who are suffering from diabetes also, they are not able to fight, some of them, because their immune system, as a result of the diabetes, it's already compromised. There are those who are suffering from already renal diseases, those who are going for dialysis sometimes 3 times a week. We've got quite a number of such patients in our province who are suffering from renal diseases. Those are the ones that we fear most, that once they get attacked by this virus, because in its nature, after it has attacked you, it has gone down, destroy your lungs, go also attack your kidneys, even others, it attacked their heart. Some die of cardiac failure complications, some die of renal complications. So hence we say, comrades, we want to at all time protect the vulnerable. The vulnerable, we are referring to those who are already compromised, who are already sick. We are referring to the elderly, our senior citizens, who majority of them you find them in rural areas. And we must be honest to say, we need to protect those ones, because once the virus starts to attack them, unfortunately there might be little that we can do, because the virus, we have said it several times, that we don't have a vaccine for COVID-19 as we speak. We also don't have a treatment for COVID-19 as we speak. The antibiotics that we continuously administer to those who, it's to deal with certain secondary infections. Of, for instance, if you would have had any bacteria, pneumonia that is there, we will definitely have to put you on antibiotics after we might have culture and test your specimen to the laboratory. So we're saying the WHO, then after it had announced that we do have this, and announced on this, I think 7th of January, that we do have COVID-19, is the new virus, as I've indicated and explained what is it. It was then later on, towards the end of January, declared as an outbreak by the World Health Organization, and it's indeed an outbreak. As a country, we started preparing ourselves to try to be ready to say, we are part of the global family. We are not outside the entire global family. We are traveling. And when we look at the relationship that our country has with China, it was very clear that also we've got a lot of people who are on a daily basis who are traveling to China, and also from China to South Africa. We started preparing ourselves, guided and led by the Minister of Health, Dr. Mkhize, who must indicate he has provided that particular leadership in the country to say provinces must be ready. We also, as part of the government, we know that while the African National Congress is a ruling party, they've also at the same time given us the responsibility and deploy us to make sure that the health of our people, of the nation, becomes our priority. That's why you see us doing everything that we can to protect the majority of the people. And the majority of our people are poor, especially looking at this particular province that we're in. We then started to make preparation in our province specifically. We started looking at our 2 major border posts, where we looked at the Beit Bridge and also looked at the Groblersdal Bridge that is bordering us in Botswana, to start putting systems in place to make sure that within the port health system, at that time we were still screening you. What we were screening was to say, have you been outside the country? Because we didn't have any case in the country. So the message was, have you visited Europe? That was the message. And we started to do a lot of work. The ANC was leading in terms of the campaigns. I remember even our first in the Khotla this year, we had a lengthy discussion and debates. How can we protect ourselves here, together with the alliance partners, to make sure that Limpopo citizens get to be protected from getting COVID-19. 26 February, the first case was reported in the province. That meant in the country. That meant we must up our game. And of course, we continue to work hard now to say, are we ready? We identify Pietersburg Hospital to say, this is a hospital which will be a treatment center, meaning anyone who would be infected and cannot be isolated outside would require daily medical assistance. People who are symptomatic, who are mild to severe ill, we identify Pietersburg Hospital, wherein there is Ward Q, which we renovated specifically to can admit those who are mild to severe, who can still breathe on their own, who don't need assistance ventilation. But at the same time, we also look at the same Pietersburg Hospital, where we had to get a house where we are going to convert it to be an ICU, which currently has got 4 beds with 4 ventilators to be able to assist, because the virus, when it attacks you, it paralyzes you. You can't be able to breathe on your own. As in its nature, it's a respiratory tract infection. So we have to get you to be ventilated when you are in your severe form. So we have got those 4 beds, which we think, if indeed our work that we are doing now does not really achieve what we want to achieve, the 4 beds will not be enough. That we need to say it upright. We will need much more to can be able to admit. We are learning on a day-to-day basis, learning from other countries, learning from other provinces. And some of the decisions that we make as a province might not be the popular, because they are unique to Limpopo. We look at our situation, as the topic is saying, which I'm still going to come, on its impact and effects on the rural area. We know for a fact that in our province, 92% of the population cannot even afford a single private health care, meaning they are not working, because it's only people who are working who can be able to afford private health care. These are people who are dependent on social grants. Now, when you develop your plan or your strategy, you must put in your mind, at the back of your mind, that you are dealing with a population that already is vulnerable. Already these are poor people. Already when you speak about self-isolation, it's a concept that does not exist in a township, in an informal settlement where 7 to 10 people would be sharing a shack. That will not be practical. When you talk of self-isolation in a village, because what is it? We grew up, many of us, we grew up in the villages, wherein we are sharing one radavel, being many of you. So you already know that you are developing a plan or a strategy which will not be the same as how the Europeans, which some of the first world country would have been able to develop theirs, because yours, it's unique. You are dealing with the rural, of the most rural. So as we have indicated, we've got less than 8% of the population that can be able to afford, that can be able to understand what you mean when you say self-quarantine or self-isolate. So that is why, as a province, as we continue on a day-to-day basis, we'll develop policies and we'll continue to review them. Of course, we will not do things that are outside the law. We will be guided by the national disaster management framework that is there, but we'll do everything that we might sound to be unique from the province. We already have we started to have a case in the province. Our first case was one of the medical practitioners who traveled to the overseas and came back. Upon return, he went to speak to the boss, to the employer, and said to the employer, look, I've been away and I don't think it will be wise for me to be at work. He was not symptomatic. He's young, healthy. He didn't have any cough, anything. But maybe because he was that type of a medical doctor who had read what is happening in Spain, which he has visited, and say, I will want to protect my people. I would like to protect my co-workers, the patients that I'm supposed to see and consult. And then he decided to go on a self-quarantine before he even tests. While in the process of self-quarantine, we always applaud and always use him as our reference, because while on self-quarantine, he on his own went to do a test, and he tested positive. And then he immediately informed us. While on quarantine, self-quarantine, he was not with his family, he was not with his children, he's with his family, he was alone. That's what we mean. When we say you are quarantining yourself or you are isolating yourself, you must be isolated in the true sense of isolation. So people think, they will say, I'm isolated, saying I've never been to the mall, But being around the family members, you are risking the very same family members when you are saying you are isolating but you are with them. We must indicate that this particular doctor, even when his groceries will come to an end, he would be communicating with us to say, look, I am running short of this, to show that he was truly committed to the word isolation. He isolated himself. 14 days later, we went back, we took again the specimen, we took to the lab, he came back cleared. He was the first case to be cleared, the first case to be admitted. If all the cases were to be like that, we were really going to win on this particular battle that we are finding ourselves in. Of course, after that, we've had quite a number of cases that are in the province. As time goes on, when we start to see the local transmission. What do we mean by local transmission? All the cases that we're having as a province were imported cases. These were the cases that will come from abroad. And we must indicate right up front, we don't even have a single case in the province. I'm not sure in the country, but as far as I'm concerned, even in the country, I haven't had a case that has been imported directly from China. The cases that we are having in the province are cases that are coming mainly from Europe, from the US, from all the other countries, but we don't have cases that are coming from China. That we must indicate. That is why when the national government through the military came to the province to inspect the range to find it suitable that they can be able to quarantine the 14 that the 114 South Africans who were currently in Wuhan. What gave us comfort was to say when the Wuhan was still at its peak, what we say in the graph is it was peaking. We did not repatriate them. We did not evacuate them. By the time when we evacuate them, the Chinese were starting to realize what we are referring to as the flattening of the curve. They were starting to see that. So you would see that the risk at that time has now been reduced. And all those were tested prior being evacuated and being brought here. And upon arrival, they were again tested. And after being tested, then they continue with their quarantine period. And it was an incident-free. They were then, after 14 days, President declared it a green zone, and they were released to go home. So you should understand that those we were quarantining people that we knew they had tested negative, but because they are coming from an area that was declared an epicenter of coronavirus in the whole world at that time, because it started in that particular city, we could not risk and say, let them go and integrate with the rest of the population before we could be safe. And the 14 days, what informs it? It's 2 to 14 days. It's the incubation period of the virus. We gave an allowance because initially we were saying we'll give 2 to 14 days. Should there be any incident, then it will push to 21 days so that after to give allowance for also the results post 14 days. But the results came out very early. That's why they were released after their 14 days. So when the cases continue to increase in the province, we started to get worried. There was statements that we made that we discussed as government. We are led by the Premier here. We have the command center, which is the provincial command council, which is led by the Premier, which is meeting every week and taking up all the reports from different departments. It's not only the Department of Health. We are just those comrades who are deployed in the health are just in a leading department, but I can reassure you the person who is leading this department is your provincial chairperson of the African National Congress, and we come in as technical experts, providing what we think would be best for the Limpopo citizen. Hence, you had when we took that resolution, and also as an advice to say, while the president is pronouncing on the lockdown, to say people must remain where they are. Our message was very clear to say, can we be stationed where we are so that we do risk, we reduce the risk of transmitting this virus. As the Premier always say, our provincial chairperson of the ANC, the virus doesn't have the legs that it can walk. But we, as human beings, are the ones who are giving it free transport. We are able to transport it from one individual to another, from one area to another area. So that is why we are saying we had looked at our province, its uniqueness. This is a rural province. This is a province that has got a lot of poor people in the rural areas. This is a province wherein it's got a lot of elderly and the sick. And we look at our statistics of all the chronic illnesses that we've indicated, and we're saying, once you start to allow and don't caution people who are currently employed, because we know that many of us are in Gauteng, in Cape Town, in Durban, for job, for economic activities. We are going there to seek for work so that we can come and feed our families because of the nature of those provinces that I've indicated. And we look at the number of cases that are in those provinces. And those number of cases were very high compared to rural province like ours. Ours is a rural province. And we will never lie to anyone that we are not a resource-constrained province. We are a resource-constrained province. It's very difficult to even attract expertise, the specialists to come and work in this particular province because of its rurality. Whereas when you are talking about those provinces that are in the city, that are in the metro, they're able to attract all the expertise to Geneva. So when we advise to say, don't move, even before the lockdown was even pronounced, we were saying that because of the pain that we were feeling, because we knew that once it hit hard in our rural areas, in our township, it's going to be difficult to trace them. It's going to be difficult to manage them. We were not against anyone coming to visit their loved ones. It was a question of because we know how much the people of Limpopo love their families. We know for a fact, I know myself, I love my mother. She's my only surviving parent. And I know many of us in the province, we love our parents, we love our grannies. Now, the lifestyle that we live, including myself as an MEC, becomes a risk to can be infected. And when I'm infected, I go and infect the old lady at home. She's old. She will not survive the virus. I might survive the virus. So that was the pain behind all that. And of course, many of the citizens of our province heeded our call and they understood what we were talking about. We went all out to talk to even those who were on N1. You'll remember that the provincial chairperson of the ANC, comrades Chupuma Tawata, led us in that campaign to make sure that we screen those who are coming. That was just part of the awareness to say you are entering a province that is a province of peace, the province of people who love. We've got a lot of love. We were not against you visiting this province, but we are just conscientizing you that if you experience these symptoms, try to visit our facility. And before you go to a clinic, try to wear a mask so that you don't go around spreading the virus on your way to the clinic, because that has become a problem. We've noted that many of the doctors, especially those in the private setting, who have diagnosed or even taken the swabs of those who were suspect, they end up, when you have left, end up having to close the practice for some days and try to work on disinfecting it because it would have been infected due to the fact that somebody they knew they are suspecting they could be infected, but just walk to the practice and in the process meeting even other patients who are already compromised, because when you meet patients, those patients are already compromised because they are there because they are patients. If they were not patients, they will not be going to that. So when you go to the clinic, if you are suspecting that you've got COVID-19, call us. That's why we're saying you can call us in the province and we can be able to assist you so that when you visit, you cover your mouth, you cover your nose, and you avoid and you practice social distance. We have done all that. We are at a stage wherein all has happened. We have got cases that are there in the province. We have now started the past 2 weeks seeing a local transmission, because I was talking about cases that are coming. The first cases were coming from overseas. Now there came cases from other provinces to be in the province Limpopo. We already have got cases from Western Cape. We've got cases from Gauteng. These are, people who have tested positive while they were in Gauteng, or they had visited recently Gauteng, hardly 7 days in the province, started to have those symptoms. When we test, they get positive. They're here. Now, when we start to experience cases of somebody who has never been outside the province, outside the country, testing positive, and then when we look, you realize that it's the spouse or it's a family member who is already positive. That tells us that the self-isolation is not working. That's what informed us to say, as a province, we have no option but to say, let everyone who tests positive be isolated. And that's where it all comes from, to say, let's isolate anyone who tests positive. Because self-isolation, it's just lip service. Self-isolation, it's just good, beautiful English. It's difficult not only because people thought those who can't self-isolate is those who are staying in informal settlements and villages. But equally, those of us, even those who are living in, whether it's a 15-bedroom house, we have noted that self-isolation is difficult, because you still have a helper at home who cooks for you, who wash for you, who does all that. They wash it, do all your laundry and everything. And unfortunately, they becomes the #1 victim to get infected. When we say self-isolate, we mean you should also be extra careful that they are protected. And we are saying, when you are self-isolating but you are staying with people, we expect to find you wearing a mask when we get to your home. But we find people not wearing masks. We find people who are having those mild symptoms not wearing masks, but staying with other people who are negative. So those have become an area of concern for us. Hence, we took this decision to say, as a collective, as a province, as Limpopo government, we would advise that we made places available for everyone to be isolated. This is also in line with the National Disaster Framework, because if you have noted, over the weekend, we have also been dealing with cases of people who are visiting or people who have been in other countries after the whole total lockdown was declared by the president. There was also an agreement to say South Africans who are staying outside the country, they are allowed back into the country. And unfortunately, people who came to South Africa via Beitbridge, even if they are going to KZN, they will have to come via Limpopo. So when they get to Beitbridge, what we do, we quarantine them, because that was a pronouncement which was agreed to say you must quarantine them for 14 days. And when we quarantine them at Nwanedi Game Reserve and Nels Play and quite a number of them, Nyala Game Reserve, they are not decided by us. The military has gone through them and found them to be befitting for quarantine, like they did with the Range Hotel. So when we say to people who are entering Beitbridge, you will be taken to forced quarantine, we want you to stay there for 14 days so that if you do have that virus, it will show itself within the 14 days. If it doesn't show itself within the 14 days, believe me, after 14 days, it would have cleared itself. And when we release you after 14 days, you will not infect anybody. So the 14 days is just to protect everybody around you. Because this is a notifiable disease, and it has to be treated as such. It's not about you as an individual. It's not about your status in the community. It's not about, because there was a couple also which was saying we can afford our own hotel and what. It's not about that. It's about government making sure it protects its citizens, and mainly the vulnerable and the poor. So that's why we're saying when you enter, we want to be sure that you have done the quarantine 14 days period. We still have a total of 24 that are being quarantined in the province as we speak. Some of them, they are coming from KZN, as they are still passing because they come from Victoria Falls, where the Zimbabwean government immediately after declaring a lockdown, they kick them out of Victoria Falls. That's information which is there for public consumption. So when they arrive here, we welcome them and we did quarantine them, and we'll continue to do that to anyone who is coming back from wherever they are coming from. We're doing that to protect anybody who's entering the country. We are at a stage when, as I've indicated, the virus it's in the province. We are starting to see local transmission. You have seen that the whole of last week, the Limpopo government, which is the ANC-led government, has been crisscrossing all the districts. We have covered all our regions in terms of the ANC. Today, the chairperson of the ANC is leading government to Thulamela municipality in the Bembe region, where we are monitoring compliance in terms of those that we are asking that when you go to buy, you should be going to buy groceries. We are not expecting people to be buying wheelbarrows during this time. We've seen people really, they are using this opportunity as the time for shopping. That's not the time for shopping. This is the time for you to go and buy essentials, buying medication, visiting a doctor, buying food for your family. Use that opportunity for that. And even in the process of buying those, make sure you observe the social distance. And all the shop owners, we're expecting them to make sure that they sanitize all their employees as they enter. Even the employees when they are working at the tellers, they should be able to have sanitizers so that they can be able to sanitize their hands after each and every custom. We are discouraging the fact that people are using gloves when they are working on the till, and we've been explaining to them that when you're busy wearing your gloves, you think because you are protected with the gloves, you do not care. You are touching money from me who is infected, and my money which is infected, you are transferring it to another person as a change who you are going to infect. So when you are a teller and you are wearing all these gloves, you have become a transmitter. You will be transmitting this virus from one individual to another, because you will be touching the surface, touching where we will come and touch as your customers. So we are discouraging the wearing of gloves. We are encouraging the sanitization of every teller immediately after seeing a client. After helping a customer, sanitize your hands. Yes, you can wear your mask to protect yourself as you'll be talking to us, because you don't know whether we are infected or not. What is the role of the mask? We've been very clear to say the mask, we usually encourages that those who are coughing, who have got flu, must be able to wear the mask so that they can protect other people from their infection. So anyone with flu or anyone who's coughing must wear the mask. And after that, the next person who can be wearing the mask would be your healthcare workers who are on a daily basis risking their lives, because these are frontliners. Anyone working in a hospital must be able to wear the mask, because they don't know who's coming to the hospital, who is infected and who is not infected. So they need to also protect themselves, because some people will be coughing but just decide to come to the hospital without wearing any mask. And we're saying even those that don't have mask, if you are coughing from home, put a scarf around your nose and your mouth, which you will be able to protect others from you infecting them. Just cover your mouth and face with a scarf and arrive in the hospital. Immediately when we see you wearing your scarf and whatever, you even jump the queue, because we quickly come to you and even give you a mask to take you. I'm not saying people tomorrow, all of you will be wearing the scarf, so that you jump the queue. But we're just saying, comrades, when you know you are coughing and you don't have a mask at home, the scarf is enough for you to wrap around your nose and your mouth so that you can go and protect other people, other patients out there. You can also protect the staff, because just imagine, as a rural province which has got limited resources, especially the human resources, if those that we have get infected, what is going to happen? Who is going to take care of you when you get sick? So that is why at all costs we will make sure that we protect our frontliners. So we have seen many people wearing the mask when they are going just to the mall, saying they are protecting themselves. We've got many types of masks, but I'll focus to the two types, the surgical ones that we wear even when we are in the hospital, when we are working in other areas which are not sensitive. But we also have what we call N95 masks. These are the masks that we are using as our last defense. When you are working in the area where you've got patients who are with highly infectious disease, we know TB, MDR, TB, it's highly infectious. We use the N95 mask, especially that is an airborne disease on its own. So we also have the COVID-19 now. When we're treating Ebola also, when we're treating any highly infectious disease, irrespective of whether it was an airborne or whatever, we always cover our mouth and our nose. Those are we use the N95 mask. Now, when we see you in the shopping mall putting an N95 mask, sometimes some of you putting it on the neck, not because you were talking or doing something as for temporary and then you will take it. We just see you around, walking around. It pains us because as we speak, we've got a serious shortage of those masks. Those are the masks that we must reserve for our professionals who will be on a day-to-day basis risking their lives because they are trying to save our lives. So if we can, all of us, be considerate and don't find ourselves playing with those N95 masks, we will really appreciate. I've already explained in terms of the gloves whether we really need them or not. We don't see it necessary. What is necessary is for us to be able to wash our hands for 20 seconds regularly, frequently, until we end up diagnosing you as having that obsessive compulsive disorder of washing your hands, because it is critical that when you, whatever you do, you must be able to wash your hands. And this is how we wash our hands. This is how we properly, you see, you can see what I'm doing. You must be able to do all this. Within 20 seconds, you will be done and your hands will be clean. Because this thing of doing this, you're not washing your hands. But washing your hands, you can see what I'm currently doing, and that it's the correct way of washing. As I'm going through my in the middle of my four fingers, the thumb is not attended to, if you can see, and then even when I go, the thumb is left out. That's why I must give attention to my thumb. So this is the correct way of washing our hands, and if we do that, we know we will be reducing, because the virus is in our hands. The virus is transmitted to our hands. Now, coming to the effects it would have had on the rural areas, we have already given you, I'm sure from the background that we were giving, comrades now understand we can't afford to have this virus in our rural area. Firstly, the people in the rural areas do not have access to quality health care. The nearest clinic, on average, to many villages is between 3 and 7 kilometers. We are supposed to be at 5 kilometers. We are not yet there. Hence, we wanted to implement the NHI, so that through the NHI, we can be able to have access to quality health care. People in our villages do not have the health care that we have in the towns and in the cities. People in the villages do not have access to the doctors that those who are in the cities are having. the medical specialists, those who are in the cities are having. Also the socio-economic issues and the infrastructure challenges that we are faced in the rural areas. When you talk to them to say, wash your hands with water and soap, I can tell you when I finish talking on whether it's a radio or any interview on TV, before you even finish, there will be calls that are coming in to want you to explain to them, what do you mean when you say they must wash their hands for 20 seconds every time before they eat, after eating, when they go to the bathroom, after coming to the bathroom, when they touch anything, they must go and wash. The question that they always ask is that we don't even have drinking water. What do you think, a comrade, we can prioritize water for washing our hands when we don't even have water to cook? So those are the reality that we must deal with. Hence, you would have seen that the Minister of Water and Sanitation, the MEC for Coxta in the province, together with the 5 district executive mayors and the other mayors, all those mayors with water authority, they have put up that program of distributing and delivering water tanks to most of our villages. We know we have not reached all the villages that we want to reach, but the reality and the fact of the matter is that from our perspective as a health, we must make sure that we protect those people in the rural area, because once you have confirmed cases in those areas, it's going to be very difficult to deal with this issue of water and sanitation. So those are the areas that we are always looking at. We are on a total lockdown. For some of us, it's easier to stay at home and do our work. Like now, I'm doing my work here through, I'm not being interviewed, I'm not in the ANC office, I'm sitting in my comfort zone using electronic, being able to communicate through social media, and many comrades are able to link with me and listen to what I'm talking about. This is not what, you will never find this in a rural area. You are not going to get this in the rural area. That is a fact, and we can't shy away from that. When you say there must be a total lockdown, I remember one question which one aunt of mine asked me, is to say, now that there is this thing of yours that we must stay home, the police will arrest us. I want firewood. Where will I get the firewood? And that's a reality. Meaning when she goes to fetch firewood, it's essential to her. Without firewood, she will not prepare food. As much as electricity, it's essential to me in the urban area. To her in a rural area, firewood is very essential. So these are the things that we always look at when we are dealing with our situation as Limpopo, to say, Limpopo, it's a rural province. It's got its own dynamics. Now, the best way is to put all your efforts and all your energy on a pushback strategy. Pushback strategy means you must develop policies and rules that seems to protect all those in the rural areas, not to even have to catch that virus, because you know the reality. It's gonna be very difficult for you to do that. Let's take, for instance, one gets infected in the rural area. And when you start to talk about tracing, how do we even start to be tracing? Where have you been? Where did you attend? Where, you know, at that time when we didn't even have the lockdown, it was very difficult because people in the village, I mean, my mother in the morning, she must wake up and go and talk to her neighbors. That's how it is. You must greet. She must know how their neighbors are doing. It's not us who don't even know the name of my neighbor. In the village, that's how life is. If you don't talk, you don't go and visit your neighbor. Honestly, you are somehow. So they must change this particular lifestyle to say at a funeral. You know, it was painful to explain to them that at a funeral, you must be less than 50. And they don't understand. To say, look, 50, it's just my family, my close family members. 50, it's not my relatives, it's my close family members. Because in our culture, when you talk, comrades, about my family, I'm not talking about me and my 2 daughters. When you talk about family in our culture, you are talking about you, and your brothers, step-sisters, you're also stepchildren, you're also talking about your aunt, you're talking about your uncles, those are your family, close family members. Then you can talk about your relatives who are the aunt of your and that's how it is, and we can't shy away. And of course, some people who draft these policies who are far away would not necessarily understand where we are as people in the rural areas. They would definitely not understand. And it is our responsibility and our duty to advocate for those circumstances that we find ourselves in. But we are really encouraged during the whole the past week, as we were moving around, even the villages, we've seen our people are staying at home. They would say, even if we don't know what is this thing you are talking about, we will not go outside and we will stay at home. Of course, there was a challenge of the grant last week, and we want to really appreciate also here in the province, also where we were led by the chairperson of the ANC, also the MEC for Social Development, where we have visited together with the Comrade Mabungu, who is deployed in the community safety. We were able to go around all those pay points to be able to guide. And what I was quite impressive is to see most of the mayors, and in fact all our mayors who are deployed by the ANC, whom I can talk for, I've seen them in the pay points where they were there physically to be able to provide that particular guidance and leadership to our people, because people who are getting the grants are still the very same people of ours who, when we speak for. So we've seen that to try to explain to them, and somebody was saying, why can't they easily get the money from the bank? You know, you can easily say it if you are not in their situation. We must try to understand the reality and the material conditions on the ground. So we want to really appreciate that we have seen that working and assisting, and we really appreciate everyone, especially the leadership of the ANC that has done a lot of work on that. So let's continue to keep on soldiering on. The lockdown is continuing. We believe we can beat COVID-19. As a province, we're standing at 20 cases now. Its impact, it's being felt. Of course, what is currently happening, we're feeling it, all of us. We can't say it's business as usual, but we are really proud to say the people of Limpopo has become one nation. They are working together to be able to put all the effort to fight this virus. We've seen the cooperation from all our churches over the weekend, Angenas, and also the ZCC Church, where we have seen the work that is being done. We are saying, let's continue with the advice. Let's listen to the president. Let's listen to our commander-in-chief to say we must stay at home, we must sanitize, we must wash our hands regularly, we must avoid, and as the ANC in Limpopo, we always say we can work the COVID-19. We work it by washing our hands 20 seconds. We also work it by avoiding touching our face, avoiding scratching our eyes, avoiding shaking our hands. And then we see by covering our mouth as we cough, as we sneeze, so that we can protect others. By working together, we strongly believe, as the African National Congress and the African National Congress-led government, that we can defeat the COVID-19. And we're saying, let's work together to beat it. We are 20, as I've already indicated. 10 cases are in Waterberg. We're working closely there so that we can reduce. 5 cases are in MOKABA region. 4 cases are in Vembe region. 1 case is in Nomen Mashabane, and Skukune region still remain at 0, even at the latest results that I've just received now. We are still at 0. Let's keep the good work. Let's keep the social distance. Let's continue to protect ourselves. It's not only about us, it's about our loved ones. Thank you very much. Thank you, ANC Youth League, for inviting us.